insulin resistance,
Yes.
which ultimately leads to diabetes.
Yes.
Right?
Yes.
So can we explain that also, like you explained PCOS so beautifully?
So insulin resistance is when, so I'll tell you how it works. So whatever food we eat, for example, we eat a chapati. Every food has to be broken down. The last point to which it has to be broken down is glucose.
Right.
It has to convert into glucose. So once it converts into glucose, now it's in your bloodstream. This glucose, when it is in your blood, is of no use. It needs to go inside the cell, because that's where the glucose will go in, and that's where it will create energy for you.
Right.
The food is we are eating is primarily to get energy out of it, right?
Right.
So the glucose has to go inside the cell. That's where the energy, it will convert into energy. But what happens is that this is a cell you've eaten, and it gets converted into glucose. It's still in the bloodstream. This is the cell, and then this cell has insulin receptors.
Okay.
So the insulin will open the door and let the glucose in. And then glucose will go in and convert it into energy. But for example, you become insulin resistant. What happens then is that this insulin gateway does not open. So the food that you've eaten and the glucose that has been converted sits in your blood. It does not go into the cell. And that's when your sugar levels go up in your bloodstream, but you feel fatigued out and you have no energy, because where the sugar needs to go, it has not gone there. It is just sitting in your blood and is raising the blood sugar levels up, and you feel even more tired and fatigued out when you have insulin resistance, which is a classic sign of PCOS, and it's a classic sign of diabetes as well, that you feel very, very tired.
Okay.
So insulin has become resistant and it's not doing its job properly, and that's why the glucose conversion into energy is not taking place. So that's typically insulin resistance, which happens. And insulin resistance happens at least 4 to 5 years before you become diabetic.
Okay.
It goes in the background. So what happens is that your body releases, let's say, 2 points of insulin, and glucose goes in.
Okay.
Right? Mm-hmm. So now 2 points of insulin gets released and the job is getting done. Now we're finding it a little difficult. So the insulin goes up to 3 points, 4 points, 5 points, 6 points. It's trying to release more and more insulin to do the same job.
Okay.
So it will keep putting the sugar or the glucose back into the cell. It will keep. So when you take your tests of HbA1c or sugar levels, the sugar levels are absolutely fine.
Okay.
But insulin is going up in the background. For 4 to 5 years, the insulin will keep trying hard and hard to keep this balance of sugar and from bloodstream going into the cell. But then at some point it will give up. And when it gives up, that's when the blood sugar levels go up, and that's when you become diabetic. So insulin resistance is the place where you can catch it early. Insulin resistance is the place where it starts showing up in the form of PCOS as well.
Okay.
So a lot of PCOS clients will have normal sugar levels. There's no sugar issue. But if you take their insulin fasting figures, they're very high.
Okay.
And because body is trying to do what needs to do, but it's doing it by raising the insulin levels. But if when the insulin is going up, it has a second role, which is very critical. The second role of insulin, first is to open the door of the cell and bring the cell glucose in. The second job is to store fat.
Okay.
So the more insulin is sitting in your body, releasing in one, the more fat deposition will happen in your body. So you will put on weight. So insulin resistance will make you put on more weight, and it will make you more insulin resistant. And then 4 to 5 years of struggling with this, at this point, PCOS will start show up in women. And then when you'll struggle, and then you'll become pre-diabetic and then diabetic in the future.
So when you were explaining this insulin resistance thing, right? Nutritionally, how do you take care of it?
Nutritionally, I think like why we were saying that nip it in the bud. So, jahan pe problem start hue, wahin usko theek kar do. So the good thing about this is very reversible. So it's not that, so for example, if you're pre-diabetic, you can go aage to become diabetic, or you can go piche. Right? So both ways are possible. With lifestyle, either you can go backwards or you can go forward. So if you don't take action, you'll go forward and then you'll go on medication and all that complication will come. But you can take a step back as well with, getting your nutrition right. So if you, So, for example, like I said, that insulin resistant happens 4 to 5 years before you become pre-diabetic. At that time, get your insulin tested, fasting insulin test. A lot of people are getting sugar levels checked, HbA1c levels checked, but they don't check their insulin fasting figures. So get your insulin fasting figures checked. If they are high, then obviously you can correct it there and then. So why is insulin resistance happening in the first place? Like, why are you becoming insulin resistant? So that happens because of deficiency in minerals and vitamins.
Okay.
So if your body does not have the enough minerals, because cell kya hai? The cell obviously when it opens and takes the nutrition in, that all mechanism is happening because of minerals, magnesium, calcium, potassium, sodium. All that negative positive ions are actually interacting with each other and taking the sugar in and bringing the sugar out and all that. So where are these minerals coming from? These minerals are coming from fruits and vegetables. So if your diet is high in fruits and vegetables, then your insulin resistance can actually come down, because now the cells will start getting these minerals. Once they start getting these minerals, they will start to communicate better. And then the insulin levels will not be a problem.
Right. So basically, if that means you eat more fruits, more
Yes.
vegetables. Vegetables, chalo, aap khane ke saath mein kha lete ho. But fruits, is there a time to eat fruits, or you can have it like how it should do?
So fruits, first of all, the big one is seasonal. So eat anything which is in season. So so ask. Either one way would be ask your mom, dad, because they know what comes in season.
Right.
Like I call up my mom and say, "Papita, kaun se season mein aata hai yahan to?" So she's like, "No, abhi aa raha hai, acha hai. You should eat it now." So check with someone what is in season if you don't know, and try to eat seasonal. That will give you the maximum nutrition. Because nature mein wo khud hi ugta ja raha hai itna sara. Nature is supporting that.
Right.
So when you eat that, it is loaded with vitamins and minerals of the right type at the right time of the season.
Okay.
So mangoes should be eaten in summers, because that's the fertile time of it where it's growing, and that's the time when you'll take maximum absorption from it.
Okay.
You will get the maximum benefit from it. So third thing how you can figure out what is in season is whatever is the cheapest vegetable in the market or cheapest fruit in the market is in season, because it's growing so much
That's a very good point.
that you can just buy that. If you don't know which one is season and which one is not. So try to go seasonal. And between 11 and 4 is a very safe period to eat fruits.
Okay.
So don't do early in the morning. You can do it in summers. You can do it, but a lot of people feel very cold. The first thing in the morning, if they eat a banana or an apple, they feel like sardi lag rahi hai.
Okay.
Acha nahi lag raha hai, throat infection ho raha hai. So between 11 and 4 or 5, it's a very safe period. You can take it anytime. You should have at least 2 to 3 fruits every day.
Okay.
2 to 3 fruits are very good. So UK guidelines are 5 fruits a day.
Okay.
So, but who follows it? Who has eaten 5 fruits in a day? Nobody eats, right? So we've just gone off that completely. Even when sometimes I pick 2 to 3 bananas and I just eat them.
Yeah.
And my husband looks at it and like, how can you eat 3 bananas? There's so fattening. I'm like, it's just a fruit. Like 90% is water.
Right.
But I think that concept is just completely gone out of a thing
that you can eat a lot of fruits.
Yeah, you can eat a lot of fruits, and actually it's 90% water.
Right.
And just minerals and vitamins loaded. And then because you'll never feel sick after eating 3 bananas.
Yeah, absolutely. I've never heard that itna sara fruit kha liya, to you ended up throwing up.
Yeah.
No, never.
But that can happen with cakes, pastries, but never with fruits. Never with fruits.
Absolutely right.
Yeah. So eat more fruits, eat more vegetables, eat more seasonally. And if you're scared that it'll raise your insulin levels or it'll shoot up your sugar levels, then eat between 11 and 4. You'll be fine. Yeah.
And if you don't have that issue, you can eat it any time of the day.
If you don't have it, you can eat it any time of the day.